On-the-scene coverage of ACC 2015 is supported by Effient.
I'm Peter Block here in San Diego at ACC 2015 for On the Scene. With me is Nikolai Tyen from Norway, and he has arguably a blockbuster trial to talk about, the over 80 trial. So Nikolai, tell me why or how you did the trial, and then you can tell me why it's such a great blockbuster trial.
Thank you very much for letting me be here. This is a randomized multi-center trial of patients over 8 years, randomized to either an invasive or conservative strategy in patients with a non-estivation myocardial infarction or unstable angina. So we randomized 457 patients, 229 in the invasive group and 228 in the conservative group, and followed them over 1.5 years.
Okay, so let's be absolutely clear. These are acute coronary syndrome patients, not STEMI patients, not STEMI patients.
No.
Is that correct?
No, that's correct.
So anyone who gets a STEMI above 80 gets that opened up anyway. Is that correct?
Yeah, of course. Yeah.
Okay, so acute coronary syndromes, patients over 80 randomized to conservative therapy. What does that mean, conservative therapy?
Well, it's conservative would mean optical medical treatment according to guidelines, but not an invasive treatment.
Okay.
So it's medication primarily. Yeah.
All right. So, you know, the over 80 patients are always sort of tricky. Some of them have calcification of their arteries, and you look at them and say, do I really want to go there with a stent? Others don't have so much calcification, and you might make that decision more easily. Yeah. How did that work out in the randomization? You just randomized them all and said, do the best you can?
Well, everybody was randomized, and if you look at the patients who went to the invasive group, it's just like you say, some of them have a really lot of calcification and you don't want to touch it. And that's also one of the reasons that not all patients with this non-estivation myocardial infarction was revascularized. So somebody would just let go, but approximately 50% had a PCI, and 6 of them were sent to CABG.
So half of the patients that had randomization to intervention, in fact, got the intervention.
Yeah. Yeah.
Fair enough. So why is this such a wonderful trial? Why did I say that? You tell me the outcome, because the outcome is really quite wonderful.
Yeah. The primary outcome of the composite endpoints were highly significant in favor of the invasive treatment. And it was primarily driven by myocardial infarction and need of urgent revascularization, but we did not see any significant differences in death and stroke. It's not powered for that. But an important fact, we will also look at the quality of life in these patients. We haven't done it yet, but we will do that. That's also an important issue here, I think, in this group.
Absolutely. Now, let me ask you specifically about stroke, because over 80, everyone is worried about the transverse aortic arch and moving through there. What percentage of your patients who had invasion had strokes?
I don't know exactly the number of it, but it was no differences in the two groups. So we didn't actually have many procedure-related infarctions. We did not. We always used the radial access too. So in 90% actually.
So the radial access may or may not have had more of an effect, because in fact you do go through the carotid bifurcation.
Yeah,
so
sure. Yeah.
Whatever. Yeah. In any case, let me just ask you a question then. So you are now 85 years old yourself, and you have an acute coronary syndrome. It seems quite clear that you would choose, wouldn't you, to have an intervention. What would keep you as an individual patient from saying no thank you?
Well, I don't think I would say no thank you. As I mentioned in the speech, if we look at patients over 8 years, they got a life expectancy of 9 years. So you can just imagine what you like to do in 9 years from now. It's a pretty long time, and I would go for the best treatment, and I think that's the invasive strategy.
All right, there you have it from the man who gave the paper. 80 is the new 70, I guess. Is that the way we should say
I guess
it?
So.
And so invasive strategy clearly wins here in patients over 80 with acute coronary syndromes. I think that's great news for a group of patients in whom we really didn't have very much data, and you have shown that there is a clear-cut differential for patients to have intervention.
Yeah.
Thank you so much, Nikolai.
Thank you.